Hello, everyone. Thank you all for joining us today. I'm Beth Whelan. I'm a member of Silent Spring's Board of Directors and also a former epidemiologist for the Centers for Disease Control and Prevention. I'll be moderating today's event. For those of you who are new to us, Silent Spring is a scientific research organization and a leading authority on cancer-causing chemicals in our everyday environments, with a particular focus on breast cancer prevention. If this is your first Science Cafe, welcome. Our Science Cafes feature conversations with experts on a variety of topics related to environmental health and are made possible thanks to generous contributions to Silent Spring Institute. Thank you to our donors for supporting these events and our science. A few details about today's program. I'll spend the first 30 to 40 minutes guiding our guests in conversation, and then we'll open things up to the group so you'll have an opportunity to ask questions. Throughout the program, please submit any questions for our guests using the Q&A feature. A quick housekeeping note, we love hearing from you, and the chat will be open throughout the program for comments and shared insights. To keep it productive, please be respectful and mindful that this is a shared space. And again, when you have a question for our guests, please drop it into the Q&A rather than the chat so we don't miss it. And a final note, the program will be recorded and made available on our website and our YouTube channel. So let's get started. Today we're going to talk about the secret chemistry of hair extensions, how this work advances our understanding of the unique exposures Black women face through everyday beauty products and the disproportionate impacts on their health. I'm delighted to introduce you to two leaders in this space. Dr. Elissia Franklin is a research scientist at Silent Spring Institute. Trained as an analytical chemist, she applies her expertise in mass spectrometry combined with biomonitoring to address chemical exposure inequities affecting Black women. She also leads the Power Project, which leverages social media to help Black women reduce their exposures to harmful ingredients in beauty products and advance environmental health literacy. Dr. Franklin earned her PhD in analytical chemistry from Purdue University and hosts the Research Her podcast, highlighting health disparities and underrepresented voices in science. Dr. Tamarra James-Todd is professor of environmental reproductive epidemiology and deputy director of the Center for Environmental Health at the Harvard T.H. Chan School of Public Health. Her research focuses on how environmental chemical exposures contribute to pregnancy complications, chronic disease risk, and health disparities, particularly among Black women. She also studies disparities in exposure to endocrine disrupting chemicals in personal care products and develops pregnancy and postpartum interventions aimed at reducing diabetes risk and improving long-term maternal health. She received her PhD in epidemiology from Columbia University Mailman School of Public Health. Welcome to both of you. It's great to have you here today. So let's start right in. Elissia, question for you. Earlier this year, you published a study in which you identified dozens of harmful chemicals in hair extensions. Can you walk us through what that research was and what you found?
Yes, thank you so much, Beth. Can you all hear me?
Mhm.
Okay. Thank you so much, Beth. I want to start with saying I'm so honored to be here with you both, Tamarra, Dr. Tamarra James-Todd. I'm especially honored to be here talking to you. A lot of the work that she did, her epidemiological studies really set the tone and paved the way for this work to even be relevant. So I just want to lead with that. So when I think about the background of my work, it's like really starting with some of the work she had to do during a time where this was an acute topic. She really had to do a lot of convincing folks that there was an association between the products we're using on our hair and, these health outcomes. And so now, there's more to stand on to say, hey, this is a topic that people should care about. So when it came to hair extensions, what we really wanted to do was get a understanding of what chemicals were generally in products. So that means from synthetic hair products, human hair, banana fibers. We even looked at some eyelashes. And what we first did was what we call a non-targeted analysis, where instead of looking in and saying, hey, we want to look for these very specific chemicals in the products, and is it there, yes or no, and at what concentration? We did a broader analysis of the hair extensions, where we collected the data first and said, like, hey, instrument there. What do you see? And then based on what the instrument was able to detect, we then went in and tried to identify those chemicals. And once we identified them, we narrowed it down to the ones that we know were of health concern. And so what stood out to me when during the process of this study was really that there were a bunch of chemicals we couldn't identify. And then of the ones that we were still able to see some chemicals of health concern. So these are chemicals that are associated with things like breast cancer, birth defects, and reproductive harm. And yeah, so the study now has received quite a bit of media attention. So it's been picked up by BBC, NBC. It was mentioned on Good Morning America, which I found pretty cool, pretty cool, and a few podcasts, Inside Climate News. A lot of our partners and other like organizations have also shared with their communities as well. So very excited that folks are really receiving the the findings of this study well.
Great. So tell us what led you to do this study in the first place. It's such a comprehensive analysis. How'd you get there?
Yeah, so it grew. It started with when I first joined Silent Spring. So this study has been in the making for a little while now. And when I first joined Silent Spring, I was very ignorant to the environmental health space. And so one of the first topics that was kind of being mentioned at our research group in our staff meetings was about flame retardants and how at the time, we were helping individuals, we were publishing a paper about how we were helping individuals swap out their furniture. And in particular, what the study found is by swapping out the furniture, we were reducing the concentration of flame retardants in indoor dust. So, what stood out to me was this idea that we're helping people get rid of flame retardants in couches. However, I grew up on the south side of Chicago. People from Chicago love to tell you that that's where they're from. I am one of those people. And I would frequent what we call beauty supply stores. And beauty supply stores just have rows and rows of hair extensions. And a lot of them will have on the label flame resistant, flame retardant. I always thought it was a good thing. It wasn't anything I concerned myself with until I started having these conversations with my colleagues at Silent Spring. And they're like, no, these can be chemicals that, are associated with a lot of issues. And so I'm like, well, if it's okay to have it in the couch, if it's not okay for us to have some of these chemicals in the couches, why can women wear it so intimately and expose themselves potentially chronically to these chemicals?
Mhm. Yeah, that's interesting. And when you did the work, what did you feel surprised you the most?
Yeah, so the chemical category that stood out most to us, our research team, was the organo-10 compounds.
Mhm.
Those were particularly, they stood out because one, they're a category of chemicals that have been used, I guess, more traditionally for the anti-fouling of boats. And so it keeps the barnacles and the clams and everything from sticking onto the boats. But what they found was, through studies, that it was actually causing harm to aquatic life. And so it became banned from use. Some of these organotin compounds became banned from use on the ships. And because of the harm it was causing to aquatic life. Well, you do more toxicology studies and you find that they are also associated with harm in humans. So from endocrine disruption to associations with cancers. And to see these chemicals that we weren't looking for. Again, like we did a non-targeted analysis. So had we done a targeted, we would have never found those chemicals
Right.
because we wouldn't have gone like searching for them. But
Mhm.
because we did this non-targeted analysis, they stood out because we weren't looking for them, but there they were in about 10% of our samples.
Very interesting. So Tamara, this problem isn't really limited to hair extensions, right? Hair products in general have received a lot of scrutiny. Can you tell us about your interest and your work in the area?
Sure. So I also want to echo Alicia here and just say thank you all for having me today. Really excited to be here and also just to give kudos to Alicia. It's wonderful to see this research continue to be carried forward into new spaces, new inquiries, and new solutions that can come from asking questions that have often not been considered of value and to see it being valued more and more. So thank you for the amazing work that you're doing and so many at Silent Spring are doing in this space. I'll just, I've been kind of intimately connected to Silent Spring and it really brought about an aha moment that I had back as a master's student at Boston University, where Dr. Nancy Maxwell, who at the time was at Silent Spring, was my professor in my introductory course in environmental health. And so that was kind of my first connection or meeting and knowledge of Silent Spring. But in that course, she presented some research that she and others at Silent Spring had been doing around magazine advertisements. So looking specifically at products that were marketed towards women over the years from different magazine target audiences. So ranging from like Ladies' Home Journal in the 1950s to Essence Magazine in the 1980s. And she really showed this striking difference where you could see that by the kind of 50s, 60s, there was this kind of phase out of advertising for like hormonally rich agents in personal care products, skin products, and so on among magazines that were targeting white individuals. And that for those that were targeting Black individuals, you kind of started seeing this creeping in an uptick of like hormonally rich agents. And I remember thinking, like, why would you market hormonally rich agents? Like it kind of sounds good, like maybe, but the why was kind of missing. And specifically, there was a product that I remember seeing in the beauty supply stores that Alicia mentioned. I'm also from the Midwest. I'm from Kansas City. And so walking into these beauty supply stores, Kansas City, Missouri, by the way, not Kansas, you would see like these, like an overwhelm of different products and being able to kind of placenta-based products was one of these that she kind of shows in this course. Of course, my classmates were like, "Oh my goodness, what is that?" And just for full disclosure, we're talking about typically sheep and cow placenta, but the why was missing, and the why it was really being driven by our beauty standards of like what makes people think of beauty and think of an individual as beauty and recognizing that there's social acceptance, economic gain, all sorts of other things. But most importantly, as it related to that particular course and what my aha moment was that there were chemicals being put in, whether in this case this was estrogen, progesterone, other things that were present that were natural, but there are also these synthetic, man-made chemicals. And I was working in a breast cancer lab with Dr. Tim Lash. And in that lab, I had the opportunity to be kind of interrogating health disparities and learned about a case series where there were four young African American girls ranging in age from 4 months old to 4 years old. And they had all developed breast and pubic hair. And after kind of figuring out like all the different products that were being kind of used in the home, it was found by Dr. Chandra Tawari, who was a pediatric endocrinologist at the time, that the girls were all being exposed to hair products that contained endocrine disrupting chemicals. So I put two and two together. I was doing this in the fall semester of 2000, the year 2000. And it was in that kind of aha moment. Could it be the products that we use every day, particularly products that the Black community is being targeted to use and is using for a variety of reasons because we do need to add moisture to our hair. We do need to have protective hairstyles that ensure that we're able to navigate and manage, walking around in the world and in healthy ways. But how might that actually be impacting what we're being exposed to? And how does that impact our health. And so I made that my dissertation research, and fast forward 20 plus years later, this work, really getting to be able to ask these questions to prove to people that personal care products matter, that there are differences in the patterns of personal care products that we use, and that personal care products are a major source of endocrine disrupting chemical exposures and other harmful exposures that can contribute to disparities that we see with respect to health disparities. So I don't know that that's like kind of the full arc, but really understanding that it did start with some of the Nancy Maxwell sparking that interest years ago.
Yeah. And so from that point, then how have you seen any changes? How have things changed since that first experience in the early 2000s, especially with endocrine disrupting chemicals?
I think so we still, and I would say even like back in the early 2000s, there was a lot of work on endocrine disrupting chemicals that was being done in men's health. So especially when you're thinking about these chemicals, these plasticizers like phthalates and so on, a lot of the studies up till like sometime around the time I started studying this was really focusing in on like male reproductive health outcomes, thinking about these in the context of like these are, anti-androgenic and so on. And one of the things that's been really, I think, a critically important pivot is to recognize women's health matters. And so much of the questions were questions that one could also be asking in women, and that there are, sex differences. There's differences with respect to what you might see for a variety of health outcomes. So I think starting to asking those questions in different time periods across people's life course. So again, when kind of doing women's health, people would kind of stop at pregnancy. So women as the vessels of carrying the next generation, and not really think about that in the context of, what might be happening in midlife, for example, during the perimenopausal period, what might be happening, in kind of young adulthood, and thinking about gynecologic health and other health outcomes. So starting to ask those questions and seeing increases around that. And I think most importantly, recognizing that we can't just stop at thinking about one chemical at a time. And we're exposed to, chemical mixtures, whether that's in the everyday products that we use, which, on average might be, I just last week was in a high school classroom teaching, and I asked the students in the classroom, high schoolers are using a lot of products one could maybe imagine. And it really does set up kind of their life course trajectory as far as like what they're using, but also like what they may continue to use moving forward. So like just within that classroom, it like spoke right back to some fairly recent work around like 14 products a day they're using for personal care products, which, these are 15, 16-year-olds. But I think understanding that if we really want to intervene and think about risk reduction, we've got to start thinking about what the sources of the exposures are. And we have to start being able to understand and ask the questions about whether or not those sources, such as hair extensions and hair products and other personal care products and beyond, these consumer products at large, what are the major drivers of exposure, and what are the major drivers of, those consumer products as it relates to health and health outcomes, because it has a real impact on, thinking about things like disparities, but also on the cost. Like we're spending money to make ourselves sick. So how can we do better?
Interesting. So Elissia, you did your PhD in analytical chemistry. What made you decide to move into the field of environmental health?
Yeah, so yes, my research at when I was working on my PhD was around characterizing lipid structures. And at the time, as if I didn't already have a lot going on, I decided to start a podcast as I was finishing my dissertation. And the podcast is the Research Her. You mentioned it earlier, Beth. And I was looking for topics. The podcast focused on Black women's health, and just as you all know, there a lot of research ends up behind paywalls and is not translated to some of the communities that need the information most. And so that's why I started that back in 2019. And I found paper that was based on actually Dr. James-Todd's, I think she had done a survey and trying to understand women in New York's, the products that they're using. And Silent Spring did some product testing of those particular products and found that there were endocrine disruptors in those products and asthma associated chemicals. And that was when my world changed. That was when I was like, I want to change my career. The method that they were using was mass spectrometry to identify these chemicals. And I was like, hey, I can go over there into that space and actually use my training in a space where my community is impacted and I can do something that I feel like is more in touch with, moving ahead, issues with health disparities and things like that. And so I finished my dissertation, did a postdoc with with Purdue, and at the time looking to pursue Silent Spring, and I sent a email to Robin Dawson, I think in Rudell, and just say, hey, here's my resume. Y'all are hiring for a research assistant. And then Ruth Ann got back to me like, hey, yeah, actually we have a postdoc coming up soon. So if you're interested, and I guess the rest is history. I've been at Silent Spring now since 2021. So that's pretty cool, full circle
Yeah,
story.
it is a great story. So you've also been doing some work with social media influencers, and what a great way to inform people about these kinds of issues. So can you tell us how you're doing that? What kind of work are you doing?
Yeah, so we are partnered with the Resilient Sisterhood Project, which is a nonprofit in the Boston area, and their work focuses on women of the African diaspora and educating them around reproductive justice issues. And with them, we have started the Product Options and Women Engaged Research Project, which actually started as it's a community-based participatory research project, and we worked with RSP at every step of the way and figuring out the direction of the research. When we first started the project, it was us communicating with 25 Black women in Massachusetts and really wanted to understand where do they get the information that they get around the products that they use. And what we wanted to learn more about is, did they know about the topics of EDCs in the product or endocrine disruptors in the products that they're using every day? And what we found was like one of the major ways in which people are getting information was through social media and influencers in particular. And so we took that information and we progressed the study or the project to focus on working with social media influencers so that they can share this information with their audiences about EDCs and other chemicals of health concern in beauty products. And so we've now worked with over 20 influencers and we've reached over 150 social media accounts with this information. And with those influencers, we've also published about this work where we did surveys before and after a social media campaign. And we found that both the influencers and their audiences had, showed signs of improved understanding around EDCs in personal care products. In particular, after viewing a post, 80% of respondents said that they will now consider a product's ingredients when shopping, when it was just about half prior to seeing the post published. We also saw that more respondents of the post survey said that they would try to avoid specific chemicals like parabens, BPA, PFAS, and fragrances. And these are in a survey. I don't know if folks know how in a survey you can get yes or no questions, or you can fill it in. These respondents were actually typing in, hey, I will avoid PFAS and I will avoid BPA, I will avoid parabens moving forward compared to, and that those numbers doubled after the campaign versus before the results we got before the campaign. And so what we're seeing is, evidence that both the influencers and their followers are learning from these campaigns, and this is potentially an effective way of getting the information on to folks who probably aren't typically targeted in a broader sense. A lot of I guess community-based participatory research can sometimes be the participants within a study. So you're educating a small group of folks who were recruited, and what this allows us to do is expand that knowledge and get it as far and as wide as we can in a way that is, I guess, I don't know, just in a way that it can continue to grow exponentially and get to a lot of different audiences that may be hard to reach.
Yeah, that's great. So Tamarra, we do learn a lot about our health, get our health information from social media. What can we say about the role of physicians, our doctors in this issue?
Right. So I think, to just kind of make the connection back to what Elissia just spoke to, I think one of the reasons that social media is so, I don't know, it's very much used by the public is because I think there's this gap with respect to kind of health education when it comes to environmental risk factors. So clinicians aren't traditionally, in medical school, nursing school, you name it, they're not taught about environmental health. Like there might be a module on like lead poisoning, and there might be another module on like mercury in fish, and that's it. And so when you're talking about what we're talking about today, the average clinician, unless they're personally interested in this topic, is not going to be able to be an effective counselor, if you will, or health, educator, communicator, except, around this, except that's really an important role in being able to communicate and educate the public around health issues. And so there was a survey that was done a few years back, just kind of looking at, what percentage of clinicians actually speak to their patients regularly on topics beyond lead and asbestos, for example, and it was only 7%. And that's it's really disheartening because, again, the trusted folks, the folks who are supposed to have training in this, who are supposed to be kind of the gatekeepers of like, good health outcomes, can't communicate. And when I walk into a room and I'm giving a talk at grand rounds and I'm talking to clinicians, I usually start off my talks with, how many of you all have ever been asked, should I stop doing this or that, particularly in the context of pregnancy? And then how many of you all feel, so everybody raises their hand. I think it's like the why, but how many of you all feel capable, able, confident about counseling? And like almost every hand goes down. And so we really sought out in a way to think about solution. Like our lab often thinks about, it's one thing to kind of continue to document difference, document disparity, document, all the bad health outcomes that somebody might have. I don't know about y'all, but that doesn't make me feel good as a person. And so what if we started to ask the question, like kind of moving why, which really drove us to thinking about the source, but then the so what, like what can we do about it? That's really what people want. And that's what really helps to build trust. So a clinician being asked the question about, should I not use hair extensions during pregnancy? Which, by the way, pregnancy is a period when people want to seek out protective hairstyles. So they're maybe using, braiding hair and so on during pregnancy as a time period in which that they're trying to do something right, if you will, reduce their exposures, and yet, unbeknownst to them, they're being exposed to a whole host of other things. What can we do about it? So one of the things that we did was we launched under the leadership of in our lab, Dr. Catherine Tomshow, who is an expert in environmental health literacy. And to the point that, Elissia, like, but I really appreciate what you're saying, because it's like your social media as a tool to improve environmental health literacy within the public. Here we were kind of using continuing medical education as a tool to improve environmental health literacy among clinicians. And we used a narrative-based approach to do this, where they had an opportunity to see different patient stories around like what did the patient really want to know during pregnancy and during the postpartum period, but also what could they do about it? And what we saw was a significant increase in environmental health literacy. And most importantly, we went from about 2% of clinicians talking to their patients about these chemicals and ways in which they could reduce their risk, particularly around reductions in certain personal care product use and so on. So 2% to over 90% discussing this with their patient population, both immediately after having done our course and training to even 2 months after. Like they kept doing it, and it was one of those things where it just shows that if you can educate people, including the health educators in our world, it's an opportunity to really potentially improve pregnancy health across the board through doing this. So I think that is a really critical point of like, how can we engage multiple, kind of key actors when we're thinking about health and healthcare, particularly in the context of environmental factors.
Yeah, that's great. And I know that you're working on a book related to this subject. Can you tell us a little bit about that?
I can give you just a little taste, just to say that this really came about because I was talking to a friend, and we both have graduate degrees. We're both kind of health oriented, all of that, and as I kind of time after time as we kind of spoke, um, I noticed that like I'm very kind of more kind of Western medicine focused, and perhaps that's because I'm sitting adjacent to these hospitals, and I think about the kind of like our traditional medicine here in the U.S. And she's much more like let's seek out natural medicine, natural solutions, and it's not that either is kind of worse, better, whatever. But what I started noticing is as we were talking in the context of women's health, there was so much that was kind of out there about diet and like family history and genetics. And there was less and less out there, like as we spoke about kind of the role of the environment. And Silent Spring's all about that.
Mhm.
And certainly there's plenty out there, but particularly in the context of certain stages in a woman's life, the fact that like environmental risk factors are not something that are commonly and regularly discussed, like even in the context of our current healthcare infrastructure, if a clinician doesn't even, they're not necessarily capable from a training perspective of speaking with a patient about this, what does it mean about what we value as a society? So this book is really in honor of what does it mean to be a woman in a world that hasn't really valued the role of environmental factors as it relates to women's health across our life course, and how can we do better? What does it mean to ask better questions? So
That's exciting. So when will your book, what's your timing for the book?
um,
Say.
it'll be a couple of years. It'll be a couple of
Okay,
years,
you're
and
working on it.
I'm excited to
Great.
make that contribution to the world, and hopefully it'll help continue the conversations around these issues, particularly because as women, we're again going back to the sources of exposure. Like I appreciate and contribute to the science that is looking specifically at the chemicals and health outcomes, but the really being able to understand how can we intervene, how can we do better, and what is it that as women we take on that really puts us at risk of risk. So that's something that I'm really trying to, you know, address in this
Yeah,
next chapter.
great. So, Alicia, when reporters are asking you questions about your work on hair extensions, what's the hardest part about talking about it?
I'd say the being in a space of optimism currently, especially the paper came out earlier this year, and with the rollback of a lot of just policies that have helped to support in people's health as it relates to exposures from our environment, it's becoming more difficult to because the work that we do is really to inform policies. And so if you're doing this work and you're looking to help inform something that you may know may be on a standstill, it does kind of it feels like I'm not really sometimes it can feel pessimistic and feel like you may not be making an impact currently because your work is to inform these policies that are being rolled back. And so there's really that. And because I also am very heavily trying to understand like what chemicals are associated with what health outcomes, there's also these moments of when folks say, hey, what should I use instead? And what is a safer or, what is the safest alternative for these products? It becomes difficult to answer that because there's so much missing toxicological research around these chemicals. And Dr. James-Todd mentioned it earlier, just like it's not just endpoints like death and cancer. Silent Spring does focus a lot on breast cancer, but there are other health endpoints that are also relevant. Like she mentioned pregnancy. We know that pregnancy is, pregnant folks, they're in a susceptible window of exposure where it could lead to some, you're more highly exposed because of, the hormone differences that you're experiencing during that window. And so we should be looking at all these endpoints that are relevant to women as well. So again, we think about reproductive toxicants. You may have a chemical that has been highly studied for its carcinogenicity and maybe mutagenicity, but you may not know much about how it affects one in their reproductive outcomes. So whether that be fibroids or anything else associated with the reproductive system. When I think about how can I help folks with decision making, it always has to lean back on just like trying to generally reduce their overall cumulative exposures because it's just harder to say when you think about like some of the holes in uh and the health outcomes, understanding the health outcomes associated with some of these chemicals. There's also that there's this lack of transparency too when it relates to like the products. So for instance, with hair extensions, you may have a product and it gives no information about what is in it. Just here's the hair. In our study, when we were looking at the hair labels, there was only one product that actually listed the ingredients that they intentionally added to produce the hair, which we tested 43 different hair products and only one brand, I guess I should say, had listed the ingredients that they used to produce the product, and everyone else, there was no information about what chemicals were used. So then, as when you're trying to tell someone to make an informed decision, how can they? Because there's no information provided to them for them to actually make a decision because there's nothing on the label. So you're sending people into the stores without any guidance because there's only a few tips and guidances to give with regard to that. And so it's because hair extensions are so lightly like are not are poorly regulated. There is not anything in place to say, hey, these chemicals, you need to have a label, you need to make sure you're informing people of these certain chemicals in the products. There just isn't that currently when it comes to hair extensions. So it's very difficult to communicate with folks about this topic because of how much is just still to be explored.
Right. And the other issue, I guess, is that even though the label might have the ingredients listed, that doesn't necessarily mean those ingredients are safe or have even been tested for safety, right? That's one of the issues in this country anyway.
Exactly.
Yeah. Okay, so this question is for both of you. Given all this and where we are with what we all have shared with us, how should people make decisions about what to use and what to buy and what to do about the issue? And maybe Elise or Tamarra, maybe you can start.
Yeah, I mean, when I think about this question, I think about the kind of levels of ways in which we can make decision. There's the kind of what I think Elissia was just mentioning, and Beth also what I think you were really getting at is kind of thinking about at the individual level. And what I think for many, many years, people had been very and continue to be very focused on the individual, which on the one hand is great. Like we all want to like, we're humans. We want to operate and with our own agency. But Beth, I think you just hit the nail on the head. It's really hard to do that if not only in this country do we not require companies to like fully disclose the information, Alicia, back to your point of transparency, but that it just that they don't have to list everything. And my ability to not be a chemist, because I'm not an analytic chemist, I don't understand what these like 13-letter words are. Like what does that mean? And so we have tools, various apps that even you all created that can help us navigate store shelves, given that we don't apply things like the precautionary principle here in the US. But even those can be really challenging to utilize in spaces and places where these new findings are coming out and they may not have made it into these tools yet. And so people who oftentimes come from marginalized populations and communities may not be able to walk into a store that, again, if the company's not disclosing information about what's in the product, the apps can't integrate that data into their, and so it's missing. It's like there's a gap. So there's layers of like what can an individual do on their own. And then you kind of move out and think about like the role of, I love the power study. I love what you all are doing, but the role of like our friends, our family. So thinking about the interpersonal level. And, once we learn something, so, you all are here, you're learning. And so once you learn something, it's an opportunity to go share with a friend, to go maybe put it out on your own social media post about what you learned, or to like highlight this, get this session so that people can like go have it as a bookmark and go to share with also the opportunity, I should say, to share with beyond your family this thinking about ways in which you engage with other members of your community, whether that's talking to your doctor. It's really interesting right now where patients are coming in with sometimes more information than their physician, and then it sparks the physician's interest in a topic, and vice versa. But there's an opportunity like what we did with the iHelp and DEEP studies where we're improving environmental health literacy of clinicians. So again, interpersonal level. There's the community level. So thinking about, both Elissia and I mentioned going into beauty supply stores. For anyone that has never been into a beauty supply store, I encourage you to do that at least once in your life. It's a fascinating place to go. Talk about Sally's times like 10. So they can be really overwhelming. And so being able to navigate those shelves, but more importantly, thinking about the role of like where those sit. So Dr. Marissa Chan, for example, who was a doctoral student in our lab now, working with Dr. Amizoda as a postdoc at Columbia, was really thinking about place. And so like where you live matters for the ability to find safer products. So how might we be able to engage with retailers around this? I don't know about folks, but I have definitely gone to a retailer and said like, I'm leveraging my power. Could you please start carrying this product instead? And not always do they, but more times than not, they say yes. And I find it on the shelf again, for the first time. So being able to, whether it's educating or empowering our retailers, and then really moving up to thinking about what might it take to like change the structures that are driving these things. So that I remember being, I used to be made fun of I really love my curls. I love my curly hair. I've been wearing a natural since I was 10 years old. So this is like back in the like late 80s when it was not okay. Like my grandmother would say to me, you cannot leave the house with your hair not straightened, but I kind of did not care. And so what does it look to, and you see more people embracing natural hairstyles and so on, but it took years. What does it look like to be able to start changing, debunking the myths around what is beautiful and what does beauty mean? And that's really a structural level shift, in addition to the policy level shift. So, when I think about kind of where do we go from here? It's thinking about multiple levels of ways in which we can help and aid in making decisions and changing how, like what we use, why we use it, still getting functionality out of products, but really demanding that we create and have safer products on the shelves.
Great, great. Elissia, what do you think people should do?
Yeah, I'd like to highlight again that our exposures are cumulative. They add up. So I think one thing to consider is just how many products one is using. So is there a way to reduce the number of products a person is using? Is there a way of reducing the number of products you use with like these extensive ingredients lists? A particular category that I always and I go for and I'm like, you should try to avoid is the category fragrance. Fragrance is just it really has no meaning. It's on the label as a trade secret for companies in a lot of places. So they don't have to disclose exactly what those ingredients are. So you really don't know what is in the product. It can account for thousands of chemicals. And so I always say like you have the fragrance in your lotion, the fragrance in your soap, the fragrance in your hair products. It's really hard to actually find hair products without fragrance, but if you can, like try to go fragrance free, and if you want a fragrance, maybe add it at the end with your perfume for date night or something like that. And um also consider like the we talked about windows of susceptibility and like where you are at during your like as I'm assuming we have a lot of women in the audience, like if you're pregnant versus if you know if you have adolescent or a tween or something, like thinking about these certain windows where you are more vulnerable to these exposures as well. And also like we've done research, we've partnered with Amizoda's lab. We have the Taking Stock study, which is with Black Women for Wellness and University of California, where we found that for in our Taking Stock study that when folks intentionally read labels, there is an association with the levels of the certain chemicals in their bodies. So if you avoid certain chemicals, we have enough evidence to show that that you can reduce the amount of certain those chemicals, associated chemicals in the body. We also found this with our detoxing action kit research that we did a few years back as well, that people who avoided certain chemicals had lower concentrations of those chemicals in their bodies than people who did not intentionally avoid those chemicals as well. And also just being supportive of the research that is in support of our policies to come and making sure that because it's important that we have these policies that are backed by science, and scientific studies. And so to those out there, it's like I just don't believe that the onus should be on the individual. As Dr. James-Todd said, we can have more power if we start at the top and and it had an effect downward, where these chemicals aren't allowed in the products, so that each individual is not required to look at a label, but instead we can trust that certain chemicals are already not in our products. We shouldn't have to choose between our beauty and our health. You should just be able to purchase a product that is free of these chemicals that we know have chemicals that are harmful for us in them. But I mean, I guess until we're there as a society, just consider how you can like reduce exposures, on a personal level until we get there.
Yeah, that's great. So this is great. We have a few minutes for questions, so I'm going to turn to questions from our guests. Um, so we'll get to as many of these as we can, and we're also happy to answer questions by email if we don't get to everybody. So going forward, what's the best way to address research gaps in the field of toxicology related to racial disparities?
You want to take that, Alicia, since
Uh,
More
Yes. So
toxicology adjacent, but I'm happy to too.
yeah, so one thing that has stood out to me is again, there are chemicals where we know there are some associations with cancer or maybe even reproductive harm, but then there's oftentimes the missing information about whether a chemical is endocrine disrupting. And so I think toxicologists um, could think more about, proposing those studies to better understand chemical, like the whether chemicals cause some type of hormone disruption. Specifically, we think about like chemicals that are associated with like, or those pathways that lead to breast cancer in particular, where Silent Spring. So we think about that. Um, I also think like maybe even when it comes to like health disparities in particular, I think focus on chemicals that we know folks like vulnerable folks are disproportionately exposed to or exposed to at higher levels. So considering chemicals that are of health concern and particularly that we're disproportionately exposed to um, when it comes to like race, ethnicity. Tamarra, do you have anything?
Yeah, I just wanted to add to that because I think the other thing is about it's like how do we do like I am not a toxicologist, so I don't want to speak to this, but I do work very closely with toxicologists. And one of the things I'll say is kind of the kind of traditional way of studying, chemicals in consumer products has been kind of one chemical at a time with like little understanding of what synergies may be happening in the context of like mixtures. And when we were talking about going back to like how might we make all of the science that we do more solution oriented? I think it's really important to think about the role of things like hair products as an important source of chemical exposures, of which they're not just made up of one chemical, they're made up of many chemicals. So, how can we design toxicology studies that would be better able to really address the question of how do these products as a whole and the way that people use them and with repeated exposure in mixtures form really impact health across, at different stages in life. And we did do this with a hormone receptor assay that we developed and published on a few years ago, showing that just the right off the shelf products were indeed hormonally active in their mixtures form, which I don't know about y'all, but I don't want something that I'm purchasing on, from a local store without any label on it to be actually hormonally active in some way. So that was, I think that there's ways that we can continue to innovate in this space.
Yeah, it's interesting. So maybe Elisa, this is more for you or for really both of you actually. How has your work been impacted by federal cuts to research? We talked about this a little bit earlier. Do you want to start,
I
Elisa?
can I can jump
Either
in.
one. Yeah.
Yeah. So definitely our lab has been impacted. I am at Harvard, so like definitely impacted by all sorts of changes. But that being said, um, when I write my research, I am very holistic. I mean, in the context of all this work, all of the work that we do, it's research that's really intended to understand and improve health for all. And so I don't tend to write research grants in like the vacuum of like I'm only looking within, what some might say, oh, that's a niche topic. I'm looking at it in the context of really understanding consumer product chemicals and their impact on women's health in a variety of ways, particularly the leading cause of death among women and worldwide among everyone is cardiovascular disease. So that's really what we spend a lot of time focusing in on. And so I think it's hard these days for all of us to get funding. Just in general, I think we're all like pushing towards a lot of foundation funding and other things, but to I think Lucia's point earlier, like trying to remain optimistic as we're not going to not do this work. We're going to continue to figure out how to just do that, improve the health of all.
Mhm.
Yeah, we have a very recent incident, I guess we could call it, where we were a part of a small group of people who were recognized on a federal level for our work focused on the power study in particular and expanding that work. And so it was a three-phase award where they were particularly interested in funding this was a EDC challenge. So they were the HHS was particularly interested in funding work where you focus on educating Black women about EDCs, in the environmental EDCs. And so we were one of the 15 people that were of the 15 groups that were selected for the first phase of the challenge. And that was in 2023 that we had gotten that first phase of the award. And, fast forward, and it's time to apply for phase 2 of the award. And we were one of the 6 people who were awarded or for the phase 2 award. And then it's time for phase 3. So that was 2024. And it's time for phase 3, but it's 2025. And it's time to disseminate that, that funding. And it was nearly 200K in funding that would have helped to support this work to keep our infrastructure going for this. And so this is in with Robin Dotson here at Silent Spring. So we look on the website and it's gone. We haven't received an email. We haven't received anything. It's just that we're emailing them trying to find out more about, what's next. Do you need anything else from us? And at first they were responding in 2025, but then now it's 2026 and we're not receiving anything from anyone to know whether or not, we got it. But we do know that the website is gone. So I guess that's the answer that we're looking for. But that one in particular was heartbreaking because again, it is this 3-phase and we made it, we got awarded the first phase, one of 15, one of 6. And we're like, it's promising because we're seeing good numbers in from the funding they gave us from phase 2. We were seeing really good numbers and we're just optimistic that this will, this application is like the perfect application that we submitted. And we, gave them everything they asked for, followed up. We haven't heard back. And so that was heartbreaking. But, we're still pushing and looking for more funding and trying to keep this work going. So that's one example of how things have been affected financially.
Yeah. Well, thank you. We do need to wrap things up and really appreciate everyone's questions and feedback. Everyone that's on will receive a recording of this webinar. And as a thank you, one survey respondent will be sending a survey for feedback. Will be randomly selected to receive a Silent Spring fleece jacket. And this is the last of our science cafes for the season. So we'll be announcing next year's lineup in the fall. So make sure you tune in for that. And you can check out all the past science cafes on our website and on the YouTube channel. And please visit the website. There's lots of information there, and you can sign up for our newsletter. And we briefly mentioned this, but we want everyone to know about the app that we've developed called Detox Me. Many of you may know of it already. But it does have a science-based library of practical tips for avoiding chemicals like fragrances, what to look for, and on the list that we've talked about. And then finally, of course, you can help keep the work going by supporting Silent Spring, and every contribution makes a difference, allowing this work to continue to protect people from harmful chemicals and make the world safer. And actually, at this point in time, for a limited time, the gift that you provide will be doubled thanks to some matching funds. So we hope that you'll be as generous as you can, and so grateful we are for your support. So again, I want to thank Elissia and Tamarra for joining us, and to all of you as well, and have a great rest of your day.